So how you doing, Miss Melly? What brings you here today?
Um, been having some rocky couple of months. Um, it's been going up and down with my moods. It's like one week I'm feeling happy and euphoric and hyper, and then um, the following week I'm feeling very low. I don't really want to get out of bed or really don't want to go to work. I don't want to do anything. I don't really want to talk to anybody.
Okay. How long have you been experiencing these mood changes?
Like 6 months now?
6 months?
Yeah. Yeah, they're really annoying actually because they definitely, according to my family and my boyfriend, it puts a damper on us talking and hanging out, and it just puts a whole damper on our whole relationships, on on my relationship with him and our relationship with my family. It puts a damper on our relationship.
So what you're telling me is that you're not spending time with your boyfriend and family like you used to in the
Yeah, that's just the thing though. It's like the first week where I'm feeling happy and euphoric and all that,
okay.
and hyper and everything. You can't hardly get me to stop talking, and I always want to go out and do stuff with them. And then next week, I don't want to be bothered by them.
Okay, so
Any small thing that they do could irritate me.
okay, so you mentioned to me you started experiencing this mixed emotions in the past 6 months, right?
Yeah, yeah. It's been a rocky 6 months.
So how were you 6 months prior to this?
Prior to this, I was fine. It was normal. Like if I had any emotional irregularities,
Okay.
whatever that word is, I would be fine. I would just base that off, PMS and, lady time, as I like to call it. I
Okay.
put it on that, but other than that, I've been fine, and our relationship was dandy.
Okay. So can you maybe share to me or what led you to change?
Uh,
Is there anything happened to you or that you recall?
Besides me having almost dying due to epilepsy, which is a seizure that I have in my sleep.
Okay.
Other than that, I can't think of anything. I've been fine.
So you had health issues.
Yeah.
Have you seen the doctor?
Yeah, I've been seeing a doctor about it, and they gave me seizure pills for it.
So you're under medication right
Yeah.
now.
Yeah.
So
It's supposed to. It's supposed to also help me sleep at night too, along with taking care of my seizures, control my seizures. But lately with these mood swings, I don't feel the need to sleep anymore, or at least sleep that much.
you don't sleep much?
No,
Can you tell me how many hours you average sleeping?
6 or less.
6 or less?
And it could just, my body just doesn't want to. Not really my body. My body wants to go to sleep, but my mind just says, stay up, stay up. do this, do this, do this, and this, and this.
Okay.
So it's just like.
How
and,
has that affected your daily activities? Are you able to perform your daily?
I can, but very slowly.
Okay.
And I'm sluggish at work. I'm sluggish at, you know, I'm sluggish at work. I'm sluggish at my internship. I'm just always tired. And I feel like, sometimes I can feel like can I just sleep for like 5 minutes sometimes? But I know I can't do that.
Okay. So you're sleeping 6 hours.
Yeah, that's the max.
You're working full time?
Part-time.
Part time?
So I'm in school right now.
You're also at school?
Yeah.
And you mentioned you're doing an internship.
Yeah. So it's kind of like boom, boom, boom. And that's the funny thing, because...
So you got a full agenda on you.
Yeah. And that's the funny thing, like, if I do sleep, I oversleep. I get more than necessary. I sleep to the late afternoon. But that's because I'm not going to sleep at night. So if I go to sleep late, very late, I'm going to wake up very late in the afternoon.
Okay. So
Which could make things difficult if I have to work. If I have to work, it'll make things very difficult because it'll give me a headache, and I don't want to really...
So you get a headache when you sleep less?
When I sleep more than needed.
Okay. Have you discussed that with your doctor?
Yeah, and they gave me this sleeping pill, but I hardly want to use it because I don't trust those kind of things. I really don't. But they say it's gonna work, but I'm skeptical on it.
What makes you think or that it's not going to work? Have you tried it in the past?
Yeah, I've tried it in the past. I don't like the way it makes me feel, though. It makes me feel like as soon as I take it, everything starts spinning until I shut my eyes and I lay my head down. Other than that, if I just want to read before I go to sleep, I can't even do that because my head feels like it's spinning.
Okay. What about your support group? Is your mom involved? Your parents?
Yeah, they're all involved.
Have you ever thought about maybe giving up your part-time job and so you can have more time to yourself?
I would, but then there's that part of me that wants that independence. I'm trying to save up so I can have my own apartment, so I can, show that I'm responsible. And if I just quit my job, and I like my job, don't get me wrong, I like my job. I don't want to leave it. But
Okay, you mentioned that you want to show that you're responsible.
Yeah.
Who, to your mom?
Yep.
Your parents?
Yeah, even though I'm the baby of the family and they're used to taking care of me, I still want to show like, hey, I know I'm the baby of the family, but I can still hold my own.
Okay. So it's not that they're telling you, hey, you need to get your apartment. It's
more myself.
more of yourself.
Yeah.
So pretty much to prove yourself.
Yeah.
Okay.
My mom actually got diagnosed with bipolar disorder when she was in her early 20s.
In her early 20s?
Yeah. She got diagnosed with bipolar disorder, so some people try to attach those two things, that to me as well.
Okay. Is there any other family members with mental history that have been diagnosed with a disorder?
Not that my mom has mentioned. She hasn't mentioned any of my family members having anything mental mental wise. I just know that she has it, but she can't recall anyone else having it.
How's that is that affected you, knowing that she was diagnosed with bipolar, or
No,
her taking medication? Is that has it affected you in any type of way?
no, because the way I see it is that, some things we don't have control over.
Okay.
We can't control that, and we can't judge somebody based off a mental disorder.
Okay.
It's not it's not something that we choose to do. It's not something to say, hey, I want to have this mental disorder. No.
Right. Yes. The reason I was asking you is because you mentioned to me that was your psychiatrist or your doctor prescribed medication for you?
My doctor did.
Your doctor?
I've never had a psychiatrist.
Well, I apologize. But I mean, it's like you don't feel comfortable.
Right.
What is it because of your mom?
No. It's just
Did her medication affected her in some type of way that you're scared, or I don't know, maybe you don't feel like that's going to work out for you?
It's not that. It's just I've always had control over things. I've always had control, at least partial control over my emotions and, my behavior. So this is definitely something new for me.
Okay.
And it's definitely different. And like I said, I've never had therapy before, so for them to say, okay, this has gone on for too long, we have to get this fixed.
Okay, so basically your primary doctor is the one that you have seen regularly.
Yeah.
Did he ever recommended you to seek psychiatric services?
He hasn't.
No.
He hasn't yet. He hasn't recommended any psychiatric.
Are you doing something?
Yeah.
Can I say privacy?
Yes. Sorry. Oh, sorry.
Yeah.
Sorry for the interruption.
Yeah. Well, it's like he's never really
Mention it to you,
Yeah.
or
But I guess it's also, well, now that he knows that I've had what they like to call depressive symptoms, they like to call it that.
okay.
And he mentioned maybe possibly doing that, but with my family, we've never really. Well, I guess my mom doesn't want the same thing that happened in her life to happen with me. These whole mental assessments, and she doesn't want me to feel like people are judging me.
Okay.
So I've never really went through with it. But,
Okay.
now they're starting to see, like, okay, something's really wrong here and we got to get this under control.
Okay. What about you mentioned your boyfriend. How does he feel about you?
He's supportive, but, I can tell that he's affected by
This change?
this change, yeah. He's
Okay.
very much affected by the change that's going on here.
Oh,
By the change in my moods, because, when I'm having my downtimes, I don't really want to be bothered by him.
I'd like to ask you a few questions, and you can respond to either yes or no, okay?
Yeah.
Because I've seen that you're very tired.
Yeah.
I'd like to ask you, have you ever hear voices that
Thank-
other people don't hear?
Thankfully, I don't.
You don't? How about see things that other people that are with you don't see?
You mean like delusions?
Yes.
No.
No?
No. Mm-mm.
You ever had any thoughts of hurting yourself or someone else?
No, because me as a Christian, we have this belief that if you try to, kill yourself, there's only one direction you're gonna go, and that's descending, and I don't
Okay.
want to descend. So
Okay, good. So no suicidal thoughts?
no.
Okay.
And and definitely not thinking of hurting anybody else.
You ever thoughts of hurting any animals or starting fires?
Thankfully, no.
No? Okay.
I like animals way too much, and I'm too much involved with I care too much about animals and nature to want to set things on fire.
Okay. Now, I'd like to ask you, do you drink
Socially, I do.
socially?
Yeah. So, every now and then, I would, if I know that I don't have to go to work until, late evening the
Okay.
next day, and I know I can sleep in a little bit, sleep it off. I'll have like a little bit of wine at the most, but other than that, I'm not a heavy drinker like that.
Okay. Besides your prescription medication, do you take any other drugs?
Mm-mm.
No?
Mm-mm.
Any herbal supplements?
Yeah, I've been trying this mood health herbal supplement to see if it was gonna help my mood get under control. But it hasn't been working.
Okay. So you drink occasionally socially, right?
Right. Yeah.
But do you take your medication
Yeah.
at the same time?
No. I don't take them together
Okay.
because I've been very cautious with that because generally if I do drink, I make sure it's early in the evening
Okay.
because when I take my seizure pills, it has to be right before I go to sleep.
Okay.
So I don't put them both together because I know that's a nasty combination.
Okay, so how are you feeling right now? Because you look very
Tired, drained, not myself.
Did you take your medication before you came here, or
No, I take it at night.
at night?
Yeah. I take it at night before I go to sleep. That way it can control my seizures while I'm sleeping.
Okay. So what else is happening to you right now? What's going on with you? What else is in your life that is affecting you?
Nothing really, just mainly this. And it's getting supremely annoying because it's really throwing everything off balance for me. And like I said, I generally like having control.
Okay.
Or at least having, everything in its place. But this is making everything unbalanced. So
Okay. What does your family circle consist of? You stay with your parents, any brothers, sisters?
yeah, my parents and my older brother and my grandmother for now until I earn enough money to have a place of my own, and I finish school and then I have enough money to have a place of my own.
So you're definitely, one of your, what, goals is to move out of the house?
Yeah. To graduate school and, move out of the house and, to have a good job in my field.
Okay, how do your parents feel about that? Especially knowing that, you have seizures, you're taking medication for seizures,
Um,
or your brothers.
well, the way my family sees it is it's out of our hands.
Okay.
And it is what it is. We just gotta do what we gotta do to get control over it.
Okay.
That's the main gist of it. That's the way we see it, and that's our hands are tied.
Okay. All right. So, I know we have some, maybe 8 more minutes. So, what do you expect to get from this session?
To get an understanding of what's going on with me, to understand how I can fix this, or if not fix this, then get this under control. How can I get a better control over this?
So, learning how to cope with it,
Yeah.
and that would be what? Taking medication?
If it comes down to that, sure, but I just want to be able to have a better control over my emotions again. I'm tired of these up and down roller coaster emotions. They're definitely difficult.
Okay.
And, I can't sleep at night, so I'm trying to find different methods on how I can relax myself so I can find a way to sleep.
Okay. Okay, so let me ask you this. What activities are you doing in your current life right now? Like hobbies, that will keep you occupied when you have these feelings?
I do workouts. I do, to keep my mind busy, I'm an active reader, so advocate reader, so I read books. And mainly just to escape the real world for a little while. I watch different TV shows and play my video games.
Okay, so all these activities
Yeah.
that you just mentioned
Yeah.
are pretty much home activities.
I don't really go out that
You
much.
don't?
No.
You want to talk about that? Why you don't go out?
I don't know. I've just never, I don't really have that many people to go out with, and I'm what they call an introvert, and I'm okay with being by myself. And majority of my friends are in different states. I have a friend that's in New Jersey. I have a friend that's in Texas, and they're all over. And my best friend, that's the one in New Jersey, so she's not close to me. So it's not many people I trust.
That you go out with, that you do out activities.
Yeah.
Okay, what about your boyfriend? Is there a time that you spend with him?
Yeah, we go, occasionally we'll go when I'm not having my mood swings. Occasionally we would go out on a coffee date or or a movie date or something like that. But if we're both not busy, if he doesn't have to work and I don't have to work, that's when we'll occasionally do those things. But other than that, we'll just watch a movie at my house and relax.
Okay. I noticed, when I mentioned your boyfriend,
Yeah.
I mean, your eyes just look down and to the side. Are you
I'm just,
having relationship problems right now with your boyfriend? You want to talk more about that, or
the main thing is he's worried about me.
okay,
So I don't want to worry him. I don't want to worry my mom.
okay,
And you know, he's like I said, he's always been supportive, but with these mood swings, he's
it has affected him too.
yeah, it's affected him. Definitely affected him because it was actually him and my mom together that said, okay, we gotta take you just talk to someone because this is not, you know, not normal. We gotta get this under control.
Okay, so this session is going to end in about 3 minutes.
Okay.
I would like to work out, you know, a treatment plan for you.
Yeah.
If you agree, maybe have once a week individual sessions.
Okay.
How would that? How do you feel about that? I know you're working, you're going to school, you're doing an internship. Would 1 day a week for 1 hour, would that be okay with you?
Yeah. Yeah. It'll be. As long as I can get this, whatever this is,
Okay.
under control, I'm willing to do anything.
Okay.
Because it's too much.
Okay. So can that part of your treatment be maybe taking your medication, seeing your doctor more often? I mean, how often do you see your doctor?
Every few months.
Okay.
And like every 3 or 4 months, depending.
Is he aware that you don't take your medication or that you don't like
Oh,
taking it?
I take my medication because if I don't, I'm gonna have a seizure
Right.
in my sleep. So
Because you mentioned that you prefer not to take it, so I was just wondering
well,
if you sometimes you take it, sometimes you don't.
it's the seizure
Because-
ones I take. It's the sleeping ones that are having a big effect
That are
on me.
affecting you.
Yeah.
Okay. Okay. So
Well, I mean, I take them when necessary when I know I have to get up in the morning and
Okay.
my body and my brain doesn't want to shut down. I know I'll have to take it despite its effects on.
you got a
on
lot
me.
of tension in
Yeah.
you, in your body.
Yeah.
Okay. All right. So I look forward to see you next week for the next 8 weeks, once a week, 1 hour session.
Okay.
So are you going to be committed to that?
Oh yeah. Yeah.
Okay. So this concludes our session, and thank you so much for coming.
Thanks.
And I look forward to seeing you next week. Okay.
Okay.
And maybe we can discuss more about your boyfriend and how that relationship is going, or also what kind of things you can do.
Okay.
I mean, yes, you're doing stuff, activities at home, but maybe if you do it, you'll be doing more social things with groups, or being outside the house might make you feel good. Okay.
Okay.
All right. So thank you so much.
Thanks.